In many parts of the country right now, the curve of new COVID-19 cases is bending the wrong way. Cases are on the rise in 5 provinces, with some setting new daily records. Joining us this morning for a look at what this means is infectious disease specialist Dr. Abdu Sharkawy. Good to have you back with us this morning.
Anne-Marie.
Let's bring in a map. I want to just demonstrate to people what the average number of COVID-19 cases in each province is in August, compared with the number of cases recorded just on Thursday. So in August, Ontario averaged 100 cases, Quebec had 105, Manitoba 26, Alberta 99, and BC 69, most of those under 100. They're now higher in all of them except Manitoba. What is the concern here?
Well, I think what we're witnessing here is a combination of different things. And first of all, there seems to be a sentiment amongst a part of the population that this is effectively behind us. And as we re-engage with different forms of business practice, or now thinking about going back to school, life is going to be back to normal. Obviously, that's not an accurate response to this. And on the other hand, there's this sense of almost helplessness, this sense of anxiety where people feel like they are doomed one way or the other. And so what's the point? And obviously, these are not the responses that we want to have. I think it's important to be mindful of the fact that this is not the weather. We can change the trend of COVID-19. We did it in April and May when we were just mindful of public health measures like hand washing, distancing, and masking. I think we need to remember that we can be empowered. This is in our hands. It's not something that's out of our hands.
Yeah, you bring up a really good point. I mean, in provinces like Quebec, for example, they're talking about reinstituting measures that we took earlier in the spring to try and get their numbers down. They're quite high. In BC, those numbers initially peaked back in April. They had 717 active cases reported. They were the highest in the country at one point. As of now, there are over 1,100. That's the most they have ever had. So we're also seeing that trend in Manitoba. Active cases more than double since April. A lot of people are wondering, is this what we're seeing in the country, the beginning of the second wave?
Well, it may be, but I think we don't want to get ahead of ourselves and panic. I think that what we see is a perfect reflection of the fact that if we move from an attitude of awareness and vigilance to one of relative complacency, that's what happened. Under the wonderful leadership of Dr. Henry, BC did a fantastic job in terms of their response initially, and they had the potential to have a serious problem on their hands with the long-term care facilities there, but they did it. And Manitoba, likewise, did a very good job and had a handful of cases at one point in time. Obviously, the guard has been let down. And so I think this is just a reminder that, again, we can do this. It's not something that can't be changed. And the great news is, if we do it the right way, we'll protect ourselves from the flu, which is just around the corner, and we'll spare ourselves 2 serious hardships for our healthcare system and for our communities.
Yeah, there's a lot of concern with the cooler weather, as you mentioned, and with cold and flu season, which we see every fall. We've also got all our kids going back to school. You have some kids going back to school. All 3 of mine are going. What can we do to contain a spike that could come from just that return?
Yeah, again, I think it's just a matter of keeping our wits about us. We've learned just how important hand washing is for all members of our household. I'm pretty vigilant with it with my kids. I'm hounding them all the time. They now know the minute they get through the door, they got to wash their hands. That's the first thing that we're thinking about. I think it's just the sense of awareness that we need to maintain all of these habits and make them a part of our daily routine in every action and every activity we're involved in. If we do that, this is going to serve us well for years. It's going to prevent infections of all kinds. And I think that we should really be aware of that, stay mindful of the fact that these are redeemable benefits that are going to have long-lasting impacts for us and for our health.
Well, yeah, I know there's been a lot of concern about when your kids wear or don't wear masks, but I just think be vigilant so that we can, everybody be careful as you can.
No question. And make masks a routine, normalize them. I've been getting my kids to try and wear their masks more often for longer periods of time so that it's not an unusual experience for them when they go back to school. I'd encourage everybody to do the same. Make this something that's not strange, that's not fear-inducing. Make it something that's fun and part of your personality, part of your style. And I think if we put a positive spin on this, it'll be a lot easier to maintain these healthy habits and protect ourselves and our families.
Yeah, some of those masks are getting expensive. There's some status masks out there. Dr. Sharkawy, good to have you here. We'll check in with you again. Thanks so much.
Thank you. Go Raptors.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.